Good afternoon to everyone. Yeah, welcome. Thank you for joining us for this NORDIC Health 4.0 DM Fitness. Today is Monday afternoon. And today we have two companies presenting. At 3 p.m. we have Cerenion, and at 4 p.m. we have 3D-Cell. And tomorrow there will be another three companies presenting. Just want to introduce. 3 p.m. we have Nika, 4 p.m. with Alto, and at 5 p.m. with Escom. So the presentation structure will be 30 minutes of presentation, followed by 15 minutes of Q&A. For those who have missed the earlier presentation, not to worry. You can still register on this link. And if you are not able to attend, still register, because I will be recording every sessions and they have been put up on a YouTube channel. I can send you the link. You are facing any other challenges which are not covered here, please contact me through this email contact or mobile number. My name again is Nika from Innovation Norway. And here are the 8 companies that has presented earlier. We have a total of 17 companies presenting for this program. These are the remaining 17. So without much further ado, let me welcome Yuka from Cerenion. Yuka will be presenting today. So Yuka, I will stop sharing and then we'll let you take over from here. Give me a minute. Oh, actually, I did not share anything, is it?
I can share now. Great.
Yep. Okay, you can see your slides now. Go ahead.
Okay, thank you very much. My presentation will be most likely a little bit shorter, but more time for questions then. So happy to meet you all. My name is Jukka Kortelainen. I'm the CEO and one of the co-founders of Cerenion. My personal background is originally in biomedical engineering, but I'm also a medical doctor, and my clinical background is related to neurology and clinical neurophysiology. I'm also working currently, in addition to Cerenion, for University of Oulu with a small part, so I'm working there as a senior research fellow. We have also Antti-Jussi Haapala here with us from Cerenion. So today I'm going to be presenting you our technology, C-Trend, which is a novel tool for continuous brain monitoring in intensive care. And hopefully with this technology, we can answer the theme of this amplified nurse track that we are running here. So first, a few words about Cerenion. So we were founded 2017 as a spin-off company from University of Oulu. So we have our roots in academia, and the technology that we provide has a very significant scientific background. We started the research related to this area already 10 years before founding of the company. So now we have been commercializing our scientific work at the university. Now in Cerenion, we have already 15 people working for the company here in Oulu, our headquarters, and also we have an office in Helsinki, in the capital area of Finland. Our strength as a startup company has always been in our strong IPR portfolio and the clinical expertise. So we have already 7 patents related to our technology and more to come. And then also we have carried out all the technology development in the company in a close collaboration with clinicians from the very early phase of the founding of the company, and actually already in the university times. We have also very strong clinical expertise in the company, in the team, the operation teams, and the board of the company. So we have developed our technology in a close collaboration with clinicians, and hopefully that kind of reflects to the technology that we have. So we have very strong clinical validation for our technology. We have raised more than 7 million euros as a funding, mostly from private investors. And the technology that we provide, the product, is a medical software for automatic analysis of EEG. So EEG is electrical activity, a recording of the electrical activity of the brain that is used in many different cases in hospitals, but mostly we are focusing in the ICU, intensive care environment. So our first product, C-Trend, is now available in European market. We have a CE mark for the product, which also, in addition to European market, provides us the possibility to expand some other market areas and to some extent in Singapore as well, I believe. So what kind of technology we have? So C-Trend is a software tool for analysis of EEG recording, and we collaborate with hardware companies, EEG device manufacturers, patient monitoring companies to integrate our software technology into their EEG device platforms. So we are on the market as a part of Bittium's brain status platform currently. So Bittium is a listed big Finnish company that provides a very practical, very advanced EEG recording system, EEG monitoring tool that is suitable in many ways for ICU environment, for the demanding ICU environment. And we collaborate with Bittium to provide automatic analysis of the EEG recordings that their system provides. So EEG overall has several different limitations currently in the ICU, which I will go into later slides. But overall, the idea of combining our software technology with, for example, Bittium's practical EEG recording platform is that we make the EEG and brain monitoring accessible for ICU environments and other very difficult and demanding hospital environments. Together with them, our technology is suitable for practical EEG recording, but we also provide interpretation of the recording, which is very essential because EEG is something that a typical doctor is not very experienced in interpreting for. So how our technology works together. So Bittium's brain status platform includes a disposable EEG electrode and a wireless EEG amplifier, which is attached to the ICU patient. That because of the practicality of the system, it's possible to do with an ICU nurse, while EEG typically is requiring a technician that is specialized for EEG recordings. The system starts recording the EEG immediately and provides it wirelessly to a tablet computer, which is next to the patient by the ICU bed. And there's an intensivist or ICU doctor who is capable to do the first kind of analysis or glance of the EEG recording because of the C-Trend software technology that provides it in a very understandable, very easy to interpret form. The tablet computer is in connection wirelessly again with a server that it could be inside the hospital network or provided by an outside service provider, cloud service provider. And the server system makes storing of the data easy, and also it makes remote access possible for the ongoing or previously carried out recordings for an EEG specialist from whatever location the EEG specialist or the neurologist is. So the server system makes EEG interpretation and kind of a specialist interpretation possible, and the remote access of the data recording. So before I go into details about how our system hopefully helps the kind of the whole workflow of EEG, I want to present the benefits the C-Trend software provides the whole system. So as I said, EEG is very difficult for most of the doctors and medical professionals to interpret because it requires typically a specialist. The raw EEG provides a lot of different kind of features that need to be, well, there has to be a lot of training of the medical doctor to interpret that kind of a recording. However, we have brought the C-Trend software that does this kind of interpretation to some extent automatically. So we make few parameters, calculate few parameters based on machine learning and artificial intelligence algorithms that kind of compress the EEG information in a very easy to understand form for the doctors who might not be so experienced in interpreting the EEG itself. So we, as I said, the C-Trend software is a medical device. We have a CE mark. It's a separate medical device classified as 2B because it's designed for demanding environments like ICU. The parameter itself, the software itself calculates 4 different parameters called C-Trend index, burst suppression ratio, amplitude integrated EEG, and alpha delta ratio, which are all applied to different groups of patients typically in the ICU. So we are capable of doing the outcome prediction after cardiac arrest. With these parameters, we are capable to treat the status epilepticus, which is a very severe condition of prolonged epileptic seizure activity in the patient. We are capable of detecting those seizure activity or helping the detection of this seizure activity. And also we can treat or detect brain hypoxia, which might be caused because of stroke or vasospasm due to cerebral bleed with these parameters. So because this is not in the topic or core of this presentation, I will not go into details about this, how these parameters work, but those are the kind of patient groups that we can apply our technology to. And actually we cover pretty well the international recommendations for EEG recording in the ICU with these parameters. So we have designed them to fulfill these requirements. But then to the current EEG workflow, what's the challenge regarding it and how we can actually improve it. And I think this is the core information in terms of this amplified nurse theme of this presentation. So current EEG workflow is shown here. Typically in the ICU environment or in the emergency environment as well in the hospital, there's patients who require EEG recording or brain electrical activity recording. So when we have a patient whose condition requires EEG recording, and the treating doctor, typically in the ICU, the intensivist, requires for EEG measurement. And after that, in the current EEG workflow, we need a technician to carry it out. And typically this EEG technician is working under, let's say, a neurology department. So they arrive with the EEG device system from a different department to the ICU. And during work outside office hours or during weekends, it might not be that EEG technician is not even available in the same building. So they have to come from their home, or even it could be that there's no availability of the EEG recording during weekends. So this is a clear disadvantage of the workflow. We have a delayed EEG recording because of the requirement of an EEG technician to do the recording. So then the EEG tech, when he or she arrives, carries out the EEG recording. Starting of the recording takes half an hour or even 1 hour, and then we start to do the EEG recording, which is only interpretable by a neurologist. So, so depending on whether the neurologist is available remotely or in the building, we can have the EEG specialist interpretation of the recording within, let's say, from 1 hour to it could take up to 24 hours or even more in case when there's not neurologist available. So this leads to a total time of several hours, from several hours to even several days, from the need of the EEG recording to the treatment based on the findings in the EEG recording. So this is something that we really cannot tolerate nowadays. So we might have a patient that is in a condition, let's say an epileptic seizure or status epilepticus condition, which requires immediate care within minutes instead of hours or days. So we need to really focus on improving this process. This process is slow. It's also expensive because we need always an EEG technician and a neurologist. So overall, the process has clear flaws. When we do have a delayed treatment in the patient condition, let's say there's an epileptic seizure going on, which starts actually to produce brain injury, like effects on to the patient. It really compromises the care of the patient if we don't have EEG recording immediately. It may lead to compromised care, as I said, longer stay in the ICU, and in a worst case, even like a permanent brain injury for the patient. So we really need to improve this process. And that's what we're focusing with our technology. So this brain status in combination with the C-Trend software. When we have a patient that requires EEG recording and the intensivist orders or request for an EEG recording, we can start the recording and do the EEG recording with the ICU nurse. So the system is so simple, the disposable electrode that is used is very practical to put on, and with minimal training we can carry out the EEG recording with the stuff that is already available in the ICU. So there's no outside technician needed for doing the EEG recording. Also, we have those parameters that I very shortly presented that provide preliminary information also for non-EEG specialists. So the intensivist with minimal training can learn how to use and kind of detect certain kind of conditions of the brain from the EEG recordings. So then we have a possibility to actually interpret also the EEG and the parameters right away, which could lead to a very short delay between need for the EEG and the treatment carried out based on the EEG findings. So it could take something like 20 minutes only instead of hours or days. And then the other option, of course, is that we need an interpretation of the EEG from a specialist or from a neurologist. And again, now we have a situation in which we don't know how available these neurologists are, but anyway, it'll lead to a much shorter time than the workflow, the current workflow, because the recording of the EEG is faster with our solution. So fast and inexpensive solution that potentially improves the care because there's shorter delay from the EEG recording to the treatment, and faster treatment of these patients appropriately potentially leads to shorter stay in the ICU and improves the outcome of the patient as well. So we have had C-trend and brain status in use in many hospitals here in Europe. It's actually in use in the Oulu University Hospital here and in Oulu, and also we had a trial period in the biggest ICU of Finland in Meilahti, Helsinki, which lasted about 5 months. We used extensively during that time period the technology for cardiac arrest survivors. We trained about 200 medical professionals, doctors, intensivists, neurologists, and nurses in the ICU to use the technology, and we also collected extensive amount of feedback from the using of the technology. The feedback was very good overall. The technology was considered to be simple and easy to use, making the working for the nurses easier, and most of the people who used it considered that it was beneficial in their work. So they considered that it improved the care and made their work easier in the ICU. Also, we had several different clinical benefits from the C-trend, from early prognostication information required for the cardiac arrest patients to detection of epileptic seizures and adjustment of adequate level of anesthesia. So very, very good experience and feedback overall from this trial period. So in a nutshell, I would say that in this amplified nurse point of view, how our technology fits into this program is that we can make the process of EEG recording, the workflow, simpler. We can, instead of using outside EEG technician, we can train the using of the technology for the ICU nurse. We can shorten the delay for the patient treatment and evidence-based treatment of the patient, and improve the outcome, reduce actually the costs, and this way really improve the work of the nurses in the ICU. So thank you very much. Happy to answer any questions if you have.
Thank you, Jukka. So now we enter into our Q&A sessions. For those who want to ask questions, you may unmute yourself, or you can also type into the chat box. So we are open for questions now. maybe I start with the first question then. I'm not very familiar with EEG, but let's take the equivalent of an ECG, which we do have 5 leads and 12 leads kind of ECG. So with regards to your solution now, as compared to the traditional EEG, is there any difference? Are they of the same, collecting the same amount of information for the doctors to assess, or is it something that is of a less lead or less information capture?
So definitely, this is a compromise between the practicality of doing the recording and the amount of information. So typically the EEG recording is carried out with a full EEG cap that has actually 19 channels. So all the areas of the brain are covered. With this kind of a system, if we want to do it in a practical way, we do have to make some compromises regarding that. So the system that we provide together with Bittium has a disposable electrode that's put on the forehead of the patient. So the main channels are focusing on the frontal or the forehead area. We also reach temporal area to some extent, and there's a possibility to add also 4 additional channels in whatever location we want. Typically, we cover central and occipital areas of the head with these additional channels. So in total, we have something like 14 EEG channels instead of 19 channels. Yeah, some neurologists consider that they want to do it in a traditional way. However, the intensivists who are responsible for treating the patients, they have to also address the practical issues. So if the traditional EEG is not available and there's no possibility to do a full extensive EEG recording, this kind of a practical system is something that they consider to be well enough for that kind of condition. Also, we have this possibility to do the continuous EEG recording with this kind of simplified way. So typically EEG recording is done only for 20 minutes. So it's the technician arrives, there's half an hour of preparation of the patient, then 20 minutes of recording, and then everything is stopped. So we have a very short glance to the brain function for 20 minutes only. And this kind of a system that we have makes it possible to do a long-term EEG recording. So we can do 24 hours easily with this system. So reduced electrode set, but longer duration, and some of the conditions that we want to track from the EEG are transient ones. So they come and go. So basically, this kind of a continuous recording offers a different kind of view to the whole brain function. So yeah, in a nutshell, yeah, we do have some compromises regarding the amount of information to some extent, but this is something that most of the doctors consider to be kind of acceptable.
Thank you. And has there been any kind of scientific paper that's been written to talk about what you mentioned earlier and focus on what kind of use case will it be suitable and what kind of use case that you need a traditional 19 leads kind of EEG?
Yeah, we have very significant scientific background regarding the technology that we provide. So actually the prognostication of cardiac arrest survivors, for example, we have carried out extensive research regarding that and showing how actually the C-trend index that our software provides is providing prognostic information, helping the doctors in early evaluation of the outcome of the patients. For that, we have had publications. We, for example, published last summer a joint work with Meilahti University Hospital and Oulu University Hospital, an extensive study of cardiac arrest patients. So for that, we have very significant clinical evidence. For practical issues and comparison between traditional EEG, we don't have scientific papers yet regarding that, but actually we are planning to have also those based on the feedback that we have collected from the Meilahti trial. So yeah, well, providing scientific evidence of the benefits of the system is in the very core of our function. So yeah, we will be providing more and more clinical evidence on different issues of and different areas of using our technology in future as well. But we have also that in the history.
Thank you. Okay, we have no questions from our nurses. Unfortunately, this round we don't have doctors in the midst of the sharing session. So I think this one is pretty clinical. So when you actually work with the nurses that you mentioned earlier in those hospitals where you have your trial, what was the nurses' response? As in, because these are, would they take it that this will be additional workload on them? Or what? How does the decision come about? Was it a clinical decision to have this, or how do you
so
the services in the hospital?
Yeah, so in Meilahti they actually use continuous EEG for these cardiac arrest patients that we included for our trial. But the system that they use are patient monitors that have specific, well, a couple of electrodes that need to be put in the patient's head. The diagnostic information that this kind of a patient monitor provides is nowhere close to the ones that is provided by a full EEG system or our system, but it's for kind of a very simplified understanding of the characteristics of the EEG that they use this for. And the thing is that our system is, and Bittium's brain status system is so easy to use that when they changed from this using these classical patient monitoring electrodes for monitoring the EEG to our system, they really didn't want to go back. So basically it was very laborious. It's very difficult to do, and it hardly provides any relevant information for the clinicians. So overall, they are pretty frustrated of how things are happening at the moment. And it's time consuming. It's not seen as a very beneficial for the treatment of the patient. So when they started to use during this trial period our system, they really were happy with how practical it is, but also the information that it provides. So now that we have actually our trial period has ended, and it's more now into providing a tender and the purchasing process, well, we have heard that they are eagerly waiting to get it actually in the use in the clinician, in the clinic, in the ICU again. So hopefully we'll get to that point very soon. But anyway, yeah, they were really happy in the change of actually how time demanding the EEG monitoring was for them. So we may improve a lot based on their feedback. Their workflow there.
Yeah. I think now you mentioned that, I recall that for ICU vital sign monitor, we do have modules, and one of the modules are EEG. So in fact your solution is actually even more detailed than the EEG module on the vital sign monitor, right? And it's much easier to use. So that's a very, very good replacement. But do you actually then are able to upload the data to the concentrator or the EMR system? Yeah.
So well, we use with Bittium, we use a separate server solution as I described shortly. So there's a possibility to build the software or the server inside the hospital network, or get it from an outside service provider, depending on the needs and IT capabilities of the hospital. So the data is stored there. It is possible to upload it and or download it from there and upload it to any system. But typically, raw EEG data is not stored in the patient information systems, but more like if there's a statement or report of the findings that is then stored in the patient information systems. So that is how it's done currently. So it's available and stored in a separate server solution, but the interpretation or the reports are stored then in the patient information system.
Oh, okay. Thanks.
But yeah, about the EEG modules again, so pretty much all the EEG, the patient monitoring systems provide EEG modules, and those were the ones that I mentioned already. So they are typically collecting, they require different kind of setup of EEG, and they many times don't communicate with other systems. So the raw EEG might not be available at all outside the patient monitor, and also the quality of the data and presentation of the data in the patient monitors nowadays is, I would say, that pretty limited. So it's not used for the neurologist or clinical neurophysiologist for the diagnostic point of view. It's just kind of very, very simplified information, maybe for the treating physicians or the nurses in the ICU. But yeah, for that we improve the workflow a lot, because we provide easier EEG solution, and that is accessible for neurologists, and also possible to kind of do the preliminary interpretation by the intensivist with this set of parameters that Cerenion has.
Yeah, thank you. So if we have no further questions, let me share my screen. Okay. So not to worry, if any of our users or nurses have any further questions, you can just email to me. This is my email. Then I can follow up with your crew on getting answers for you. And you are interested to get more information regarding this solution, feel free to write me an email, and also feel free to share today's information with your colleagues, especially your ICU nurses. And as I mentioned before, the recording of these sessions sessions are recorded. I have put up on a YouTube channel. Just email me and I can forward you the YouTube link. So again, for tomorrow's session, we have 3 companies, Nichat, Auto, and also Escom. And later in the afternoon, at 4 p.m., we have PrettySelf. So please stay tuned and join us at 4 p.m. as well. So we thank you, Jakob, for sharing today, and we hope to see you in the next session. Thanks, everybody. Thanks. Bye.
Thank you. Bye.
Thank you. Have a nice day. Bye-bye.
Thank you.